What is the location of fibromyalgia pain? What is the location of fibromyalgia pain? You're probably going to wonder whether you believe you may have fibromyalgia. Perhaps you're concerned about mysterious pain, fibromyalgia. Or perhaps you're curious about fibromyalgia symptoms only. Well, fibromyalgia may feel like your whole body is being attacked. But the reality is that it is situated on your body, if you have fibromyalgia pain. So, what is the location of fibromyalgia pain? Let's find out. Let's figure it out. And speak about some of the other symptoms if you've got fibromyalgia so you'll know if you have it or not. Understanding the location of fibromyalgia pain. If you ask, where is pain with fibromyalgia? The response is that in a few specific areas of the body is fibromyalgia pain. While individuals with fibromyalgia may say this is hurting everywhere, the reality is, fibromyalgia pain is so particular that physicians use the pain place to diagnose the disease. The fibromyalgia pain concentrates in 9 points on each side of the body, with a total of 18. The following are the knees. Fibromyalgia is a tender point outside the knee. The pain is above the joint and felt worse when the thumb is pushed on. The bone of the neck. Your collarbone lies just above the top of your ribcage. You will notice a bone horizontally along the front of your shoulders if you feel there. This is what you look for. That's what you look for. And you will also notice that there are 2 tender points on each side of your throat if you have fibromyalgia. The bottom of it. A new source of soft spots is the lower back. You should be able to feel them if you put your palms down towards the fuck on either side of your spine. The skull's base. And in the other direction, just where your skull and neck meet, you should discover 2 tender points. Pain on either side of the neck should be situated. The blades of the shoulder. Just behind you, your arms come across your body, is a big flat bone inside your back. It's the blade of the shoulder. And if you have fibromyalgia, both blades of your shoulder should have tender points. The legs. The hips. Another tender point for fibromyalgia is outside of your hips. This is close to your buttocks and is on either side of your body. The cockroaches. Every elbow is a tender point for fibromyalgia. Over the joint, the pain is supposed only above the flesh. Another point is that your back meets your buttocks. The pain should be just under your body and on both sides. The neck's front. Fibromyalgia is a tender point on the front of your throat. Get up and feel your neck on both sides to see if you have pain. It's just underneath the chin. There is a nice possibility you had the response to the question, where is fibromyalgia pain? If you have pain in these places, but you also have some other symptoms before you are diagnosed with fibromyalgia. Understand other symptoms in fibromyalgia. For a successful diagnosis, see, fibromyalgia's pain is not enough. There are several other conditions that can produce such extensive body pain. Your doctor will therefore seek some of these additional symptoms. Fatigue. Fibromyalgia is one of the most visible symptoms. People with fibromyalgia often discover themselves tired regardless of their sleep. This is hard to live with and is a nice indication that you have fibro symptoms coupled with pain in tender spots. Fog of the mind. Fibromyalgia has another symptom of trouble concentrating. Often referred to as fibro fog, this is a prevalent symptom. It usually manifests as a new thought or difficulty recalling easy information such as the name of the individual you met. In relation to the pain you have in these areas, you may have fibromyalgia if you have these signs. You should see a physician as quickly as possible. You should be able to diagnose or at least exclude fibromyalgia. In fibromyalgia, it's essential to begin managing it as quickly as possible so that you can find a therapy that works for you. And remember to find assistance following a diagnosis of fibromyalgia. You don't want to handle this by yourself. Before taking any medication, always concern your healthcare provider, and it is important to be diagnosed correctly. Stay healthy. Thank you for watching this. Please do not forget to subscribe, share and like our channel. Click the bell icon for latest update.